Muy buenos días, bienvenidos a la segunda entrega de la serie Diálogos sobre Innovación y Propiedad Intelectual, una iniciativa organizada por el Tanque de Pensamiento, el Instituto de Prospectiva e Innovación en Salud INNOS, con el apoyo de la Embajada Británica en Colombia, con el apoyo de AFIDRO y de la Universidad El Bosque. Los invitamos a seguirnos en la página www.innos.co, en nuestras redes sociales aparecemos como Instituto INNOS, y en nuestro canal de YouTube, desde donde estamos haciendo esta transmisión, pueden suscribirse para continuar haciendo seguimiento de los contenidos que estaremos publicando a lo largo del año. En este webinar contaremos con la participación del experto en temas de propiedad intelectual, Sir Robin Jacob, profesor de Derecho de Propiedad Intelectual y director del Instituto de Derecho de Marca e Innovación de la University College of London, árbitro, mediador, perito y asesor. Cuenta con una extensa carrera como juez de tribunales superiores y de apelación y además tiene un amplio conocimiento de los temas de propiedad intelectual y patentes. Es entrevistado por nuestro director del Tanque de Pensamiento, el doctor Carlos Felipe Escobar. El doctor Escobar es médico especialista en otorrinolaringología, con un magíster en dirección universitaria. Fue rector de la Universidad El Bosque, consultor en estrategia, innovación y transformación digital en la educación superior. En este momento le quiero ceder la palabra a nuestro director para continuar con la entrevista. Adelante, doctor Carlos Felipe.
Okay, good morning, everybody. Thanks for being here for this conversation, this coffee with Sir Robin Jacob, one of the big stars in IP today in the world. I mean, so it's definitely an honor for INNOS to share with you this time with you. We sincerely appreciate your openness for being here to share with you, with us, and with the Colombian people, both from the healthcare system, but also from the IP and law ecosystem, because well, we are absolutely sure that everybody is going to be excited to listen about your stories and your thoughts regarding IP in healthcare. So we have already introduced you, but let me share with our audience a little bit about your background, and well, just to mention some of your achievements. Well, you got your major in physics in the Trinity College of Cambridge, and then law and LSE, London School of Economics. And after that, you moved to the Junior Counsel of the Controller of Patents of Government Departments in Intellectual Property, and well, then you was appointed as High Court Judge and to the Court of Appeal, and then well, the list will be very long. But I would just say, Sir Robin Jacob has been recognized in many ways by the IP system. IP Hall of Fame in 2006, and well, outstanding achievement in IP awarding in 2012. So well, I guess that we can not have someone better to join this conversation today. So we're really and sincerely grateful with you by your time, and well, let's start, and we're eager to listen to you and all your experience. I will leave you with Juan Carlos, the Chief Intellectual Property Office of El Bosque University, and also one of the leaders of IP in INNOS, this think tanks and initiative of El Bosque University and the National Association of Research Pharma Labs. And Juan, well, it's a pleasure to join with you this conversation with Sir Robin Jacobs.
Thank you, Carlos Felipe. You are right. Firstly, I want to say thank you very much one more time to the Professor Sir Robin Jacob, because as Carlos Felipe said, it's a really honor for us to have you in this interview because of your extensive background in IP matters. So, dear Professor Robin, only have one question because I really want to listen from your perspective the evolution of IP. So let me move a little bit to the general context before to the question. Nowadays, we're talking about a huge ecosystem of intellectual property law, not only in the advanced countries. We're talking about many elements of intellectual property around the world. We're talking about patents, of course. We're talking about waivers. We're talking about innovation, entrepreneurship, matching with IP rights, but also we're talking about some controversial issues of IP related to artificial intelligence, for example, for industrial revolution in general. So my only question for you, dear Sir Robin, is that could you please share with us the evolution of the intellectual property that you have seen in all your career, from your academic perspective, your litigation perspective, and of course your perspective from the court. So,
okay, it's a sort of a bit of my story. Well, as you rightly said, I went to Cambridge and I wanted to be a great scientist. And in my second year at Cambridge, I realized I was not going to be a great scientist. And I had a lot of lawyer friends, and I decided to become a lawyer. I'd never heard of the patent bar, really, but nobody else wanted me, so I joined what was a fairly moribund, quiet backwater, as it seemed. I've never really understood why it was a quiet backwater, and it wasn't always so. And intellectual property consisted of patents, trademarks, copyrights, and designs, but we're going to focus today just on patents. And it's not self-evident that patents are a good idea. They stop people doing things. Well, why can stopping people doing things be a good idea? And throughout the history of the patent system, which really began with the Industrial Revolution, although you can go back to Venice, the first European statute of 1474, and the kind of English statute of 1625, but it really started mattering for innovation in the time of the Industrial Revolution. And at the time, even then, people said, well, this is a bad system. It stops people doing things. So you can find Jeremy Bentham in 1792 saying, if you don't get patents, you think they're a bad thing. Once you understand them, you think they're a good thing and they should be property rights. And the first thing you might say to the critic of the patent system is, well, I know it stops people doing things, but it's things that didn't exist before. You couldn't have done it without this invention because it wasn't there. After all, we don't grant patents for things that are old, and we don't grant patents for obvious things. And we don't grant patents for things you can't work out how to do. And what's more, it's only for a limited period. That's the sort of very big background. But there was a huge anti-patent move in the middle of the 19th century, stronger than it is now, actually. So strong that they abolished patents in Holland for 30 years. Nowadays, Holland is one of the top patenting countries. They saw the error of their ways, Philips particularly. So when I joined the bar, it was quiet, but there was some litigation involving pharma. And I found myself involved as a very junior lawyer in a case about some stuff called phenothiazine, which was used as a serious antipsychotic at the time. Not a very satisfactory drug, and it's no longer used. But then it was the best thing there was. And was it inventive or was it not inventive? and the court held that it was. And it was quite a high-priced drug. And the company that made it was then called SmithKline & French. It's now Glaxo Wellcome, mergers of different companies. And what did they do with the money? Well, some of it they went to the shareholders. That's true. But some of it went on something else. A man called Black had invented the beta blockers, a whole class of new medicines for controlling blood pressure. And SmithKline had invited him to come and work for them. And he had another idea, also based on blocking things. And the blocking thing this time was to do with stomach ulcers. Stomach ulcers were pretty nasty things to get. My grandmother had it, so I remember it very well. And people had operations to try and cure it. Well, otherwise, you're on a milk diet, and it was very nasty and quite widespread. Well, his idea was that this was caused by too much histamine being secreted in the stomach, which caused acid to be secreted. So the stomach had too much acid. So he said, if I can block the histamine sites, then it won't make the acid. There won't be histamine, and there won't be the acid. But people said, but we know about antihistamines. They already exist. That they're the kind of things we take when we have a cold. Your nose is running. He said, it's a different kind of site. Don't know how he knew it, but SmithKline paid for 7 years for him to do his research. And I was at SmithKline the day they had the first report of a human being taking this medicine. He'd gone down to University College Hospital, and they'd put a pipe down through his throat, down to take the stomach acid and measure the acid level, the pH. And he took some histamine, and you could see the level go up. And then he took the first of these prototype medicines, and you could see it go down again on that graph. It turned out to have side effects, because you have to do a lot of research to find out whether the side effects and so on. They found a better one, and it was called cimetidine. And it became the best-selling medicine in the world at high prices. Nowadays, it's one of the 100 essential medicines of the World Health Organization. It's out of patent, and it costs no more than aspirin. And indeed, it's not. It has so little side effects. People even use it for conditions which are nothing to do with ill health. But if you get too much acid from your stomach because you drank too much the night before, you take cimetidine, or you take a rival one which was invented by Glaxo called ranitidine. And the story of that medicine is the story of many medicines. If you look at the list of 100 essential medicines, many of them were patented once. And they were high-priced medicines. Now the world has them. No command economy, such as the USSR or old China, ever produced a new medicine. And this is risk money. And you've got to get people to spend the money and take the chance. Now, I agree that big pharma companies behave badly sometimes, like to extend the life. You would. That's commercial. But always, sometimes you hear talking of something like evergreen. You can't evergreen a medicine. Once the patent is expired, anybody can make it, in principle. And I've seen this pattern time and time and time again. And the changes I've seen over the years is the pace of innovation has improved. We're getting more new medicines, although there was a slowdown to some extent in about 15, 20 years ago. Other things have changed. The medicines have become much more complicated. Those cimetidines and aspirin and things are little molecules, little baby things. They're quite easy to make. You don't need a big factory to make a lot, because a small dose will go, is all people need. A 10 milligram tablet, that means a kilogram of active ingredient will make 100,000 tablets. You need a very big factory for a country or for the world. And they're very cheap to make. Now we're moving to an era where things are getting much more complicated and quite interesting. And this is where we're moving towards vaccines. There have been patents for vaccines over the years. Currently, there are 3 kinds of vaccines are used for COVID. There's mRNA, which was invented, and there are a bunch of patents held by different countries that cover the principles of making mRNA vaccines. There are protein subunit vaccines, and they are basically made by very well-known old techniques. There's virtually no patents on them at all. And there's vector vaccines where there are some patents, all held by different people. So those who do not really understand the patent system say these should be waived during COVID. Well, and they don't really identify what would happen if they were waived or what effect it would have for the future. I'll start with what happened if they were waived. The answer is absolutely nothing. Not a single new vaccine would turn up. And there's a reason for that. And that's because making vaccines is very difficult. It's no good pretending it isn't and shouldn't be. It is. Nobody has actually ever asked for any licenses. There's nobody saying, I could make a vaccine, but for the patents. The world, it is true that some governments have contributed to some of the non-basic research, the sort of safety research and so on for vaccines, and there's no reason why they shouldn't have a share in patents if that's the way they're negotiated. But what we're really looking for to deal with this crisis is something very different. And it is part of the crisis of world medicine anyway. Probably the biggest problem is not getting vaccines at all, but distribution if you had them. Distribution of a vaccine requires doctors, nurses all over the place, places to supply, and so on and so forth. And that's a real problem in many parts of the world. It would be wonderful if somebody could invent, and people are trying to, an oral form of the vaccine, which could be safely stored at ordinary temperatures or refrigerator temperatures only. That would be the best single innovation we could have now. People are not very rational. The anti-vaxxers would be much less anti-vax if you ate it orally than if you had an injection. It's not one of the vital things I've learned as I get older is people are less rational than you think they are. And for example, polio, apart from a couple of pockets of irrationality around the world, has been eliminated by vaccines. So would I like to see lots of money going into research on the methods of delivery for vaccines? Yes, I would. And do I think that if anybody came up with one that worked, they should get a big reward? I certainly think they should. What the world also needs is a much greater volume of vaccine production. Well, who is better to do that? People who know how to do it now, or trying to start from scratch in some country or other which hasn't really got any scientists and engineers to do it. And we must remember that making these vaccines not only is very expensive, the plants are huge, but they're not easy to run at all. So we've seen a number of examples around the world of it going wrong with very experienced people. Do I think there more should be made? Yes, I think the government should be building many more vaccine plants, but they should be building them where they are, next to the ones they are, to be run by the same people who can teach the people next door. This is not factually not a thing where you can look at a recipe book and make it from a recipe. It isn't like that. I also think that something's got to pay for it. And I think, by and large, the rich countries should be paying for it. And my own particular obvious target is the people who made a lot of money out of COVID by accident. The high-tech companies, Amazon. I mean, they're the people who benefited from COVID. Well, they should contribute. Maybe they don't even want to because they like COVID, but they're the ones who should be paying for this. And we're talking about a lot of money about building these facilities. The recent intergovernmental meeting where they said they were going to provide 1 billion doses. Well, we're not seeing much showing up. And secondly, the world population is 8 billion people. So we need a much bigger effort. And it has to be paid for. And waiving patents has got nothing whatever to do with it. In fact, it could be worse, because if you did try to divert it, the manufacture involves, say the Pfizer vaccine, involves 200 different ingredients from different places and so on and so forth, even down to the delivery systems. And if you have people trying to buy them all up from different commercial companies around the world, then it's only commercial companies that make them, you're going to have chaos. You'd have less vaccines possibly. So I'm not only against the waiver of patents as being completely pointless and a diversion from what we should be doing, but I think it's worse than that. It is a disincentive to vaccine research. Now, vaccines have never classically made huge amounts of money for companies. Already before the pandemic, a number of companies had given up making vaccines. We need a bigger incentive to make them. I would give a 30-year term for vaccines.
Mm-hmm.
And I would require that the companies make them, but I think that's not difficult because they will do it if they're making money out of it. But quite frankly, the amount of money we're talking about for the vaccine is a trivial amount compared to what it costs without the vaccine. So the same story is true of other aspects of patent law. But what I have seen over my career is a huge increase in patenting, which is going on. Innovation is happening faster and faster. As you will know, it's almost remorseless in electronics. It's very interesting to see China playing such a large part there. China, a huge country, the biggest country in the world, population-wise, by far, coming as a fairly backward country. And it has moved forward. It has built a patent system from the early 90s.
Yes.
Deng Xiaoping was the one who really pushed it. There was a bit before. And we will have a working patent system. And now it's one of the great patent offices of the world. In technology, the features, some of the Chinese companies are complete leaders now. I think America is very fearful of that. Huawei, for example, probably the biggest, or one of the biggest 5G patentees. Yes, it was a backward company before, but building on the patent system, which is invested and invested and invested. And another thing about patents, which is that the kind of inventions that they protect make them very different sorts of things. So you can have a patent on a corkscrew. I did a case about a corkscrew once, the screw pull. Well, that's straightforward, and there the notion is you have the invention, you disclose the invention to the world, and after 20 years, the world can have it. But a lot of inventions are more complicated than that. It's not just a question of having the idea or even establishing that a small molecule will do something. It is making sure it works and is safe. And a big development over my career has been how long it's been taken to get regulatory approval for medicines. And it's now of the order of 12, 13 years. It's a hell of a long time of the life of a patent. When I started, the regulation of medicines was pretty hopeless. And as you know, or perhaps you may not know, there was a medicine released without proper testing. And it caused deformities of babies in their mother's wombs, and people were born without arms and legs and things. And the American regulator didn't allow it on. She got a gold medal for that. But in Europe, and I imagine in other countries, the thalidomide children were a serious setback to the pharma industry and spurred much, much greater regulation, possibly even to the point now where it is over precautionary. Particularly, they've changed that a bit for medicines where there's nothing else. You've got a cancer with no known cure, and this is a possible medicine. You can try that on people now because there's no alternative. So what we're looking at is a very complicated system. Many would say, well, wouldn't it be better if governments did things? Well, let me give you some figures, because this is an important aspect of it. I looked at that. I wrote a piece about it a few years back, and I got my research assistant to go to the accounts of some of the big pharma companies. And there was a parallel thing done just before by the European Commission, who were very anti-pharma. Whichever way you looked at it, the private spend on medicine research compared with the public spend, by public spend I mean direct by government, yes, or universities funded by government, was 4 to 1. Private was spending 4 times as much as governments. Now, would governments pay more? Well, you've got to have a faith in government, which I don't really have, because they don't get votes for it now. This is something, if you spend money on research now, you're looking for a medicine in 15 years' time. People just don't think that long term, unless they're thinking a secured profit, which they would have from a patent. And you will hear it said again in relation to these waiver things. Oh, the governments have funded the research. No, they haven't really. They funded some of the background stuff that led up to it, but really not a lot. 4 to 1. The figures I came out were about 30 billion paid by governments and charities like the Gates Foundation and the Wellcome Foundation in my country, and 120 billion US dollars by pharma each year. Most of the money goes down the drain. So I think the patent system is the only driver we've got. It's no good saying we wish something else. We've got what we've got. Now, let me just address the question of prices in different countries, because that's an important subject too. I think the prices in countries should be different, particularly for, and the problem is much easier for very poor countries than for mixed countries. Explain. If a poor country can't afford the medicines, then it makes sense to make them available at cost or thereabouts to those countries, provided that when you make them available to those countries, that's where the medicine stays and is used. So you've got to have systems to stop, because human beings being what they would have, they won't give it to the people. They will re-export it to a high-priced country if they can. So we've got to think about how people behave before we say ideally what it should be. And to some extent, the pharma companies have done exactly that. They didn't at first. There was the South Africa Nelson Mandela fight over the antiretrovirals that shows that so. But the line that's done. But there is a big dilemma, and I haven't really resolved how to work it out for the countries which have a big rich class, big middle class, and also a very big poor group. And the two countries, or three countries particularly come to mind, are China, India, and Brazil. And in those countries, if you lower the price of the medicine for the poor people, how do you make sure that the richer people who can afford it pay the prices of medicines similar to what they would be paying in a rich country? Let me just give you another way of demonstrating. In my country, I've done a calculation, but roughly speaking, we're sort of not the highest price, but not far off it. United States is the highest price. About 20% of the price of a new medicine is going on research and development. That's very high indeed compared with most other industries. There are one or two high-tech industries where it's 20% of sales going on research, but mostly it's much lower. And again, if you look in proportions, it's about 35% of the price of a perfume, a highly advertised perfume, will be going on advertising. It's a great shame people want to beat up on the pharma industry. They do naughty things and they should be held to account for it. And we've had cases of bribery and so on and so forth. But basically, without them, we wouldn't have the medicines. And without them, we won't have the vaccines of tomorrow. And there's one final message about that. This pandemic is pretty mild as it goes. My grandfather was killed by the great flu of 1918-19 when he was 45 with 7 children. Healthy man. He was a bootmaker. And the figure, we don't have precise figures.
Yeah.
It's of the order of 50 million people, and it took young people. The next pandemic might take babies. And that tells you where we stand about how much we should be saying it's worth investing in future research in vaccines. Because if we don't have a vaccine for it, or a quick way of making it and everything else, and systems in place, humanity's at risk.
Absolutely.
So I think it's a bit of a long tirade.
Yeah, absolutely. But well, there are so many insights that you have already shared with us that let me try to start with some of the things that you have mentioned. First, you highlighted how important is innovation and patents for healthcare, and you remind me when you mentioned it a couple of studies. One of someone called Mansfield in 1986, I guess, and then this guy showing in his research that close to 60% of medical inventions could not have been developed without a patent system. And sometime after that, in 2000, Cohen with his team show this result that clearly supports your statement regarding 50% of proper product innovation in drugs is supported by patents. So definitely when we look what we use, I'm a medical doctor by background, Sir Robin. Well, we live in an industry and a system in which are definitely dependent on healthcare innovation and on patents. However, yeah, I need to be honest. I think that the persons that are less aware of how important are patents are we, those involved in healthcare provision, medical doctor, nurses, blah, blah, everybody. Yeah, I guess we recently have a conversation with Juan and our dean of the School of Medicine, and we said, why is this happening? Let's take a look on curriculums, and let's say how we tell this history. You tell about this wonderful history of the development of anti-acids and beta blockers, etc. Well, there's plenty of examples of how all this emerged based on patents, and we just take these things for granted. We learned during our medical training that they should be there. I don't know. They should be there. That's not our problem. We are servers of health. And then what we see very frequently is that we people involved in healthcare attack these without the understanding that indeed whatever we are doing right now and we are going to do in the future with all these trends that Juan said, artificial intelligence, robotics, well, the whole new tools that we have to innovate in health, well, we rely on them. Is it the same thing there in the UK? And what should be done from academy and from healthcare, let's say, schools, in order to really put the things in the order they should be, recognize what we should and who we should recognize by the merits on providing us the tools that we use with our people?
Yes, I think you're absolutely right. Yes, we do have the problem here. We have it quite strongly. And as soon as the COVID came, the anti-patent people who have been like that for years, I mean, Médecins Sans Frontières, they are very anti-patent. It's a question of education. Really, you are right. Absolutely. You have to understand that, and it's also an attitude. The thing is, if we waived all patents now, suppose we waived all patents on all medicines now, we would have the medicines we've got now, but we would never have any new ones.
Yep. Yeah.
And it's getting the message that it's the medicines, it's the patented medicines of today which are paying for the new medicines of tomorrow.
Absolutely.
And a very nice old story, which I don't know how well it's known in Colombia, but it's a German story, is the Pied Piper of Hamline. You know the story of the Pied Piper of Hamline?
No.
Okay, well, let's tell this story. This Hamline town was by a river, little town in Germany, and it had an infestation of rats. There were rats everywhere. And people tried to do things and whatnot. Nothing could be done. There were traps and there were cats and this, that, and the other. It didn't work. And then one day, this man in a very strange suit, he was called the Pied Piper. Pied means many-colored. With a pipe came to the mayor and he said to them, I can get rid of the rats for you. And they said, well, and he said, what will you pay me? They said, well, if you can, we'll pay you 1,000 guilders. And so he went out and played his pipe. And the rats followed him. And he walked to the river and got them all into the river. They all drowned. The story has an extra bit about all the children had to be taken away because otherwise they would have followed too. And in the story, one little crippled boy didn't, and he got drowned. So it's a pretty grim German story. But anyway, Pied Piper then goes back to the mayor and asks for his 1,000 guilders. And the mayor says, 1,000 guilders? You know we were joking. And offers him 100. Now, it's the same with medicines. What would we give now for a simple pill that cured COVID?
Yeah.
$200 for a single pill? $1,000? It's cheap.
Absolutely. But
if somebody produced it, they wouldn't pay 1,000, I can tell you. And it's funny, isn't it? And it's actually one of the features of the patent system. The kind of more effective the medicine, the more you want to charge for one pill, and the more difficult it is to do it. And so there are not as many medicines as cure. It's rather surprising that there are not many medicines that cure. You know, the antibiotics do, when there's a big complaint and not enough antibiotic research is being done. Why? Because the patent system won't give enough reward. Most other diseases, you don't have a cure. There's a cure for hepatitis C that came out a few years back, and there was a huge complaint about the prices the drug company was charging, costing about £80,000 to treat somebody, but to make them well again. And the problem with that was that you don't sell a lot of pills for one patient. It's not a lifetime pill. Actually, for society, it was very cheap. This individual wouldn't be ill. They wouldn't be having hospital treatment. They would be earning. They'd be paying taxes. There were young people who get it. And the overall benefit to society is, well, a lot more than the 80,000. But yeah, it's getting people to understand and get the numbers in their heads. And that's a bit, as in most things with humanity, is trying to get humanity to be rational. I mean, we have all these people who are anti-vaxxers. They have no idea what they're doing.
Absolutely. And I guess here it comes. Let's say these arguments that we hear now. Let me tell you an example. We have now, and I think it's more in a lot in development countries. Disclaimers of we cannot put the public good and health below the interest of private industry, and that's why we definitely need to promote these waivers and all these exemptions to intellectual property. And just remember that the reason, that's also the reason we need to start locally doing from government a lot of things regarding research and production of pharmaceutical products. And just remember, and then they identify these figures like Maria Manzucato, and they say, yes, she has demonstrated that government and public investment is we thank internet and GPS because that, and then we should rely on research for essential medicines for government. It has shown that not everything should be left to industry. How do you handle this kind of arguments? I would say.
Well, I don't know really. I mean, she is in my university. I have never said. I don't agree with a single word she says. We should have focused research. I think what she called it. She likens all research to the moonshot. Well, there was another research program initiated at the same time, or just about. Mr. Nixon was going to eliminate cancer. That didn't work, did it? The moonshot was actually, she doesn't know, but there were a lot of patents taken out on inventions on the moonshot, and a lot of that's been paying for NASA over the years. So you will never get rid of these people. They were in the 19th century in the abolition. They were obviously, Mr. Bentham was writing in 1792. We're talking about people who are anti-patent. They just don't get it. They look backwards instead of forwards. One thing I didn't talk about, which they do advocate, is compulsory licenses under patents. And I had quite a lot of experience with those because we had compulsory licenses introduced into our law in 1919. And people started trying to apply for them in the 1960s. And you could just get one. Unless there was a good reason why you shouldn't have one. And there was a big fight about the rates of royalty. And in Canada, they had compulsory licenses. And even after 1977, when we got rid of them for a bit, but the old patents then had 4 more years added to their term, and for those 4 years people would get a license, and it made a lot of people very rich.
Yeah,
reduce the prices. But compulsory licensees are not interested in low prices. That's what they tell governments and the public. Actually, they would like to be the only licensee, and they want to be 95% of the patentee's price with no costs and no investment. And there is no known successful example of a compulsory license anywhere in the world.
I would like you to ask you to help us understand something that you mentioned, and you mentioned. Let's take a look at the real big winners from the financial side in this COVID. And you mentioned high techs.
Yes.
Yep. And I need you to help me understand and help us understand why, let's say, we have not in place, and I could be wrong, but I have not heard about waivers regarding taking out patents of Apple and Amazon and Google, all these big high techs during pandemic for countries to be able to produce all this technology, because they are necessary for the public good, but nobody's taking this initiative. Why we have it? We respect so much technology innovation and for healthcare and for pharma is not that way. What is the reason behind that?
Well, you're not entirely right about this. Some of the companies did do a patent waiver. There was an initiative in the United States, and quite a lot of companies signed up that they would waive their patents in relation to COVID, any COVID-related things. But there were companies like Uber and quite a lot of the high-tech companies, and I think Apple signed, because there's nothing to waive. And if you did waive the patents, what difference does it make? I mean, you can't make a telephone or things without the machinery and know-how to make it, and there are many companies involved. So it's not led to anything practical at all. It's not a patent waiver we want. They've made money out of COVID. That should be taxed. That is the one thing I do think is rock solid. They made money they didn't expect to make, more than they ever expected to make where they're invested, and they've made it out of humanity, and they owe it to humanity as a tax. That I would do. And I would use it to build more and more vaccine plants and invest in more and more vaccine research. That's the big change I would like to see.
Absolutely. So Robin, two things are happening during these days in our country regarding this, let's say, big objective, because we are aware that we definitely wanted to happen in many regions, and including our country, and is having the capacity to produce vaccine and essential medicines locally. So right now in our country, there are two routes, two lines. Yeah. By one side, government has announced a public-private partnership with Sinovac. The Minister of Education of Health has announced this intention to move in this direction of a public-private partnership and make things happen in the next future. Probably 2 more years to be handled, but that's the implementation on this partnership. And then on the other side, a legislative initiative saying, okay, this should be created by the Congress of the Republic as a big pharma facility that does research, set the agenda of what should be invested, and government should support and finance. What would be your recommendations, your pros and cons of the two routes that are in place and in discussion right now? This public-private partnership, let's say, led by a national government, or this one from the central capacity building, public financed, led by some group in the the Congress.
Well, I mean, I don't know enough about Colombia specifically, but none of those things have never worked. I mean, you can fund some basic research in universities, and if you do it in a controlled way and say you'll be doing this research and not that research, it won't work, because it's much better to let scientists do whatever they're going to do and let it turn up. They don't know what's going to happen either, but they should be allowed to follow their independent research. And you may come up with some new medicines, candidates, not medicines. But the way it's been working in more in recent years is, after that, the university has done either some sort of spin-off company, which has been bought by a major company with the power to do all the testing. Most of the money in pharma goes on testing, not on basic research.
Mm-hmm. Yes.
I mean,
clinical trials.
Yeah, it's if we could find a better way of testing, so much the better. But we can't at the moment. We don't know enough. You know, it takes us 12, 13 years and huge clinical trials before we dare release a medicine. And quite a lot of those fail right at the final stage. It was an Alzheimer's medicine. We thought there was something coming up there, and that failed. Eli Lilly lost several $1 billion. And so it's quite important, I think, really, if you're going to have some public-private partnership of some sort, and we're having the same thing with our government, to try and understand really what the really big problems are, and just saying we'll do it and somehow it'll work out is not good enough.
Mm-hmm. Great. So let me ask you a little bit of what is happening right now in this conversation worldwide regarding IP and let's say the challenges. And do you think COVID and pandemic has and will change something regarding the whole IP scenario, or let's say after these let's say initiatives everywhere, everything will once again go and settle and continue, let's say, the national development that it has had during last decades?
Well, I actually think probably we'll go on much as we did before, with the big argument saying the patent system is no good, but the patent system actually works. And yeah, I mean, you mentioned we don't know where we're going next with patents. One of the big assumptions is AI and patents. And there's been litigation now. And can you patent an invention made by a machine? And we've just had a case in our Court of Appeal, just been argued. The judge said no. The Court of Appeal have reserved judgment. Australia has said yes. South Africa has said yes. And I think the answer ought to be yes. We are using machines to make inventions better. I mean, we've used them for years. We've used computers and things and calculators and whatnot. So these are tools used by human beings. The inventions will still need testing. You need to have the investment in all that. And of course, they won't have to be patentable. In fact, it may be a problem if everything becomes so easy. And if you can't get patents, nobody will do the development work. That's one of the worries, big worries. The patent system is a bit like mining. You know, if each government, yes, you take a strip where your claim is, and you go digging there, and you may find nothing there, but you may find something there. So you've got, but just getting the strip to do the claim is not enough. A patent is a claim about something in due course, and of course, when the patent expires, if it's been a successful medicine, for example, you give the world much more than the idea that this might make a rat twitch or stop twitching, and therefore it's an anticonvulsant. You've given them all the research which has happened in all the years since. So I don't know enough really about I've never seen government playing a significant part in innovation, really. They paid a lot of people to do it. I suppose you can say that Mariella's Matsukato is right. The moonshot was a very big government expenditure. I don't think she understands any of the inventions that came out of it, nor that were patented, or that was a very different sort of thing from doing research where you don't know what's going to happen at all, and it's all very, very speculative. So if the government doesn't interfere and say you should be doing this to a university, then it could be okay.
Wonderful, wonderful. Just to close, Sir Robin, I would really invite you to tell us. Well, Colombia has set some goals and move towards building and becoming a hub for innovation and entrepreneurship in the region, and well, we're around right now definitely discussing some policies regarding strengthening the IP system and of course improving healthcare in many ways. What will be your recommendations regarding the IP regulation of our country? What to take care, what to consider for the future? You mentioned we are really facing some big challenges on regarding IP, also from these emerging technologies like AI and many more that are definitely changing the landscape of the kind of innovations that we are going to see in healthcare in the future. It's not only the small molecule development or the vaccine, but also we're having all these issues regarding tissue engineering, robotics, artificial intelligence, IoT in health, so neuro interventions, genomics, etc. So many things and so many different ways of producing innovation in healthcare that I guess that we never faced those discussions before in history of medicine, of health, but also of IP. So how to keep this pace and to adjust to these challenges we're going to have?
Well, it's very difficult for a small country. My country is a small country in this by these standards. I would be looking much more, I think, to a regional patent office.
Okay.
Very difficult to do, but I mean, building your own patent office is impossible. Okay. The reason is you can't examine, you can't do anything. So it's much better to hitch yourself to a skill thing. I would like to see the European Patent Office open its system to the world, so you could just all use the same system. But you know, people are stupid again, and then you'd have young Colombian examiners going there, and maybe you'd have a branch of the office somewhere in South America or somewhere, and maybe in Africa as well, with people changing. I mean, that's the big vision.
Okay.
Yeah, Colombia went straight to the European Patent Convention people and said, we would like to join. Well,
yeah.
And find some other countries who said, we want to join too. So you've got a pressure. I think that's one place where it could give way a bit, and they might do it and make it really moving towards a world patent office. At the moment, we've got the great patent office of the world that are Japan, China, Europe, United States, Korea.
Yeah.
And they meet up. They're called the J6.
The J6.
Yeah.
Okay. Yeah.
I think an international effort is doing something. The other problem which you have to have, and this is a very difficult problem, is a good litigation system. And patent litigation is almost different from any other kind of litigation. You know, are you going to have judges who know about the technology? If not, how do you teach them? I mean, we've got a very experienced judiciary in my country, very small compared with America or Germany. We run with about 6 judges at all levels, including yes, we have 2 High Court judges, 2 in the Court of Appeal, 1 in the Supreme Court, and 3 judges for a small claims patent IP court. But that's our litigation system, and that's your whole system, and fitting it within a litigation system is very difficult to do. But it would make sense to try and do regional things.
Absolutely. I don't know. Are you aware, Juan, of these kind of movements in our region?
Completely agree.
Yeah, but are you aware if there's something moving in this direction in the region?
No, I think the context and the particularities that mentioned Sir Robin are replying here in this context. But of course, for example, the litigation matters in Colombia are less than in other countries. We are only trying to understand many decisions of European countries or Asian countries or United States. But here in Colombia, we are only trying to walk in very slow to understand the different issues in this big ecosystem, Carlos Felipe.
I mean, yeah. Even within Europe, you see, I mean, Spain doesn't play a part in the IP system and the patent system of Europe. I mean, I know some of the Spanish judges, and they've been sharpened it up quite a bit compared with what is 20 years ago. One is a very good friend, actually, but he doesn't get much patent cases because they don't have them. Not much goes on in Ireland. May do more because of Brexit, and there's rather complicated reasons why. Still less goes on in Portugal. Again, I know a lot of the judges in those countries, and we discuss things, and some of them. Sometimes you get a judge who just simply understands patents. There's a judge in Lithuania who does. Extraordinary.
But I think that you and when I have touched a very, I would say, very important point that we have discussed here with Juan, which is it is not only that we are barely aware of patent system and IP from the healthcare, the whole healthcare system and entrepreneurial system, but also that well, there's a scarcity of research regarding the experts in IP and the firms that are dedicated to healthcare, and mainly if it's let's say specialized in something like for example health. So definitely it seems like democratizing the access of to health to IP experts and support and the process. It's definitely also a challenge for countries like us, and I guess that the direction that Sir Robin has said regarding regional offices and let's say trying to these big integrations with the offices like Europe. Well, it's definitely a direction. And
quite a sensible thing to do would be, for example, to enact as your law the same law as the European Patent Convention, a substantive law. I think it's the best patent law I've seen. It was drafted by a small committee of people in the 1960s. And there are 1 or 2 things you could make minor improvements, but basically it's a pretty good document. Well, steal it. I mean, some people do. Singapore, they've just stolen it. No, you put it another way. Of course, you flatter them and say, thank you very much. We think yours is such the best in the world, and so we're going to use it. And it's not stealing at all. It's flattery then.
Yeah, definitely, absolutely. So, Robin,
you would have a case law. You'd have a whole lot of stuff to make it work. Help make it work.
Yeah, definitely. And I guess that moving in that direction, well, is definitely to make this dream come true. This dream of having Colombia well, with a very, very vibrant and dynamic innovation and entrepreneurial ecosystem in any sectors, of course, both in health. I think that we as a country have a very competitive position in the region, in Latin America, and definitely keeping serious about our IP system is definitely big milestone to getting this kind of league we want to move on. I sincerely appreciate all the insights you have shared with us today, Sir Robin. You know, you cannot imagine how much I think Juan and me and our audience have enjoyed this conversation. And
I wish I'd been there to do it in person.
Yeah, well, definitely that should happen at some time, and I would be definitely. I think we will be very, very happy to have you here. Why not helping our team to we need to think something about teaching through stories like you did it today regarding the beta blockers and the NTIs, teaching a little bit about this for healthcare professions. Last year from INNOS, Juan Carlos did a very good job teaching some things. Let's say we agreed, the both of us, we said, let's try to put some clear examples on how to our medicine students, the things that they are facing in the day-to-day activities have something behind related to IP. Yeah. And then he did a very good work, and we have these insights. But definitely, I think that we should massify that. We should increase that. We should really make our healthcare students not only learn about, well, yes, these are the blockers, blah blah blah, but learn the story of what's behind, and then they can appreciate the nature and the creativity, the effort of the mind of human beings in research and different research labs to put the things for the service of humanity. So I would like you to leave you this idea to help us at some time to develop these let's say small courses, and I'm sure that we can in some way get the support to move on with this. I would be really happy to have something with you supporting that. But how you told us that story, I think I was amazed. So let's move on with this.
The best way of teaching is to tell stories.
Yeah, that's true. You're completely
absolutely.
That's why Christianity is so successful, because Jesus told stories.
Absolutely. Because he told so many stories.
They live on stories.
Yeah, absolutely. Okay, so sir,
thank you very much. Robin, I've enjoyed it very much.
Thank you very much.
Definitely, thank you very much for your time, and we really want to see you here very, very soon.
Okay. Well, I'd like to see you here too. Bye.
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 Muchas gracias al Dr. Sir Robin Jacob por hacer parte de esta segunda entrega de la serie de Diálogos sobre Propiedad Intelectual e Innovación, una iniciativa que estamos impulsando en conjunto con la Embajada Británica en Colombia. Asimismo, la invitación para todos ustedes que están siguiendo la transmisión es a suscribirse en el canal de YouTube, suscribirse en la página web y seguirnos en nuestras redes sociales. De esa manera podrán enterarse de cada uno de los contenidos y publicaciones que vamos a estar lanzando desde el tanque de pensamiento. Asimismo, pueden participar en la convocatoria que se encuentra abierta para recibir papers y documentos que estén en función de imaginar y pensar el futuro de la salud y la innovación en Colombia. Para consultar los términos de referencia pueden acceder a la página web y cualquier inquietud pueden escribirnos al correo electrónico coordinación@innos.co. Nuevamente le agradecemos a la Embajada Británica en Colombia por hacer parte de esta serie de diálogos y los invitamos a conectarse en una próxima entrega. Les deseamos que pasen un excelente día. Hasta la próxima.